Hi, I'm Cathy from Flatrock Family Dentistry, and I'm here to do a tutorial to show you how to use our take-home sleep test. It comes in a nice little package. When you open it up, you'll see lots of components inside, and there's also a nice little instruction sheet. There's also a cable in this first little package, but I want you to keep that in there. This is not something that you'll use for your sleep test. We use this to help download the results, so just make sure that stays in the little pocket with the instruction sheet. The first thing we're going to go over is the monitor itself. You will pin this to your nightshirt at the top there with the light showing outward. Then you've got the next thing you've got are two respirator belts, and you will attach the respirator belts to the back of the monitor. You'll just snap it in on the back. You'll wrap it around the top one at the chest level, and then the second belt will go to at the bottom of the monitor around your waist or your belly button level. So you've got these two respirator belts that you'll attach to the monitor. That's the first step. The next step is the nasal cannula. This is a disposable. It normally comes wrapped in a package, but for demonstration purposes, I've taken it out of its package. You will fit the large end of the nasal cannula into the large port of the monitor. It won't fit into any of the other ports, so you know this one was the one that it'll fit into. The instruction sheet shows you how to loop it over your ears and fit the little nasal part into your nasal area. The next part that we're going to show you is how to attach the little cheek pad. You've got two wires here. One's red and one is white, and you will attach the little sticky pad to the, you'll snap them on the back. It doesn't matter in which direction the white or the red wire attaches to the sticky pad. The other ends will fit into the monitor. There's two sets of ports here on the side of this monitor, and they're diagonal from each other. And it doesn't matter which set of ports that you use, and it doesn't matter which color of wire that you use, as long as you fit those two wires diagonally from each other into the monitor. There's also another port here at the very end, which you won't have to worry about. You don't have to use that at all. And the last thing is we have a pulse oximeter, which you will strap to your wrist. You can use your right or your left arm. You'll put it firmly around your wrist. Then you will slip the monitor over your index finger, and it will start recording automatically. You don't have to turn it on, and it will send information to the monitor wirelessly. So it will automatically start recording your heart rate and your respiration rate, your oxygen saturation rate automatically to the monitor. Now, last thing, you're all hooked up and you're ready to go. You've got your belts on. You will peel off the sticky pad and put it on your cheek area where you bite. You'll feel a muscle there, so you'll want to make sure that that fits on to the cheek area. You've got the monitor firmly clipped to your nightshirt. You'll push a button. The screen will light up, and it will tell you to hold the button down for 3 seconds, and that will automatically start the recording. The recording will last for 8 hours automatically, and it will shut off automatically after 8 hours. If you do need to get up and go to the restroom during the night, that's fine. The machine knows if you're upright, if you are sleeping on your left or your right side, so it takes all these into consideration for scoring purposes. And now that I've shown you all the instructions, keep in mind that you do have an instruction sheet in the packet that you can refer back to. But if you do have any questions, please don't hesitate to call us, and we'll be glad to answer any of your questions. We look forward to seeing you at your next visit at Flatrock Family Dentistry.